You are Miss Jarlene Fortaleza, right?
Yes, ma'am.
My name is Lynn San Jose, and I'm the nurse supervisor here in this public hospital.
Nice to
I
meet
do
you,
see
ma'am.
that you are applying for a staff nurse one position here in our hospital. So I'm your nurse supervisor here. I would just like to ask you some series of questions. That way we could conduct this interview and we would evaluate your responses based on whatever you're going to be telling me today.
Okay.
So just just answer as truthfully as possible. So here are the questions. What do you like most about nursing?
Actually, nursing is such a broad field of the healthcare system, and the reason why I took nursing degree because I know that I could take care of the patient as a whole, and I would like to know more about their general well-being because in nursing, it's not only specific into one. Category of healthcare, it's more of like the wholeness of the patient or the client. So I would like to really get to know the patient and how am I gonna improve this patient's health by doing the best of my abilities to take care of this sick patient. That way I could help them recover or help them feel better or take some relief from whatever they're experiencing right now. The reason why they're in the hospital because they are sick or they are they're having some issues regarding their health, and as much as possible I would like to take care of them and show them the skills that I've obtained from my school and the training that I've had, and I could be a very competent nurse. As I approach this career path, I would also grow into this field and I would be the best of my career, and I would also share that talent to my patients in order for me to better their health and well-being.
Which personal characteristics are your greatest assets?
Personal characteristics that I could think of that is my greatest asset because I'm such a person that is determined to achieve the goals. And in nursing, we always have to achieve some goals. As much as we can, give the best quality care as much as possible. So one of those greatest asset that I could say is that I'm competent enough to provide the client the best quality care that I could give, and I'm always constantly educating myself, going to some seminars, and obtaining some certificate for me to have that professional growth. That is a very good asset that I could say that I'm always motivated to learn, and I'm always determined to reach the goals that I've set, especially in this career. I would like to help some patients, and I would like to give the best quality care as much as possible to my clients. Where do you see yourself 5 years from now? 5 years from now, it's not really too far from now, but I know that before even taking up nursing as my degree, this is my second degree, I already told myself that I would like to be a director of a hospital because I already worked in a hospital from my previous degree. So from that experience, I was able to set my goal to be able to achieve that from in a span of 5 years. Sometimes it's not really, you know, obtainable at that short period of time, but I will try my best to be able to level up every year if possible, and I could gather all these experiences together. That way I could be the best possible leader in the future, and I really see myself 5 years from now as the director of the hospital.
What can you offer to this public hospital, especially to the nursing department?
One of the things that I could offer, through nursing is that I could offer the community like some volunteer works or some missions that the hospital is, um, you know, like, um, uh, organizing. And through this volunteer experiences or volunteer works, I'll be able to contribute to the society. Not only to the society, I also contribute to the hospital as well, so that they could the patients that are coming to this hospital will receive the best quality care as much as possible.
So I will be giving you a case situation here. I just want to know like how are you going to respond to this kind of situation. So here's the situation. So one of the licensed practical nurses in our team seems especially tired today. She tells you later that her baby kept her up all night long. And when you ask her about the new and finger stick blood glucose level on Mrs. Tanya, which is a 72-year-old patient, she just looks at you blankly and then she says quickly that it was 150. Later, when you are in Mrs. Tanya's room, she tells you that she does not remember anyone checking her blood glucose level at noon. So what do you do in this kind of situation?
So for this kind of situation, because everyone is working professionally in this field, and just a little error like that could hurt the client, or it could be of disadvantage to the client. Even just a little error could gravitate into something big. So in this kind of situation, I would inform that the staff member, the LPN, that I asked the client that if she was, if the blood glucose, random blood glucose testing was performed, and I would verify to that nurse again, to the practical nurse, and then if she says that she wasn't able to take it, or even if she denies it, I would tell her that it was not taken, and I will be repeating that procedure again. And at the same time, I would tell my supervisor that this procedure was not taken, even if it was already relayed to the practical nurse. That way, it would be corrected in the future, because those little errors like that could, gravitate into something bigger, and it could harm the patient. So that is my duty as a nurse, to give no harm to the patient. So in that situation, I will tell my supervisor that this is an error, and it should be documented as well. Thank you.
Alright, thank you, Miss Charlene. I will be calling you within the week, so just open your line so that if in case we pick you in this situation with this position, we will go through the hiring process at that time. Okay, thank you for your time and have a good day.
Thank you very much, ma'am. Have a good day as well.